Hi everybody, Neil Kravitz here. I hope you're enjoying these daily clinical pearls. I received a great question whether I can review my protocol for an adult Invisalign patient who is non-compliant with their aligners. So what I do in my office is I'm very understanding of non-compliance. I tell them, listen, there's so many reasons why the hours may dip down a little bit. For example, you may not like the fit or the feel. During COVID, I had beliefs that the aligners were a fomite for bacteria, so I was fine with people not wearing their aligners. There's so many reasons why someone may lose their compliance, but I like to first explain how Invisalign works, that it really is a force-driven system. And when I'm doing the ClinChecks, and I do my own ClinChecks, that it's really a math equation based on a predicted number of hours of wear. And if you dip below 20 hours, it's really a non-effective system. So even extending the length of time per aligner, so if you, instead of going for 20 hours a day, you go to 15 hours a day and wear them for 2 weeks instead of 1 week, it's still not as effective as just doing what you're supposed to be doing, which is 20 hours a day and then changing the aligners every 7 days. So I tell them how Invisalign works. Number two, I do not use the word you. I don't put blame. I think once you start to use the word you, this is probably a good rule for any conversation, people are going to immediately become defensive. I don't say you are not wearing your aligners, because people are going to become defensive, and we know they'll certainly be dishonest with the number of hours that they're wearing. So I just say, it looks like we're not quite getting the aligners in as much as possible, or the teeth just aren't quite tracking per the number of hours the aligners are being worn. So I don't use the word you. I'm not putting blame on them. But we really need these aligners to be in for about 20 hours a day. And if they're only in for 12 to 15 hours a day, and then I'm looking at their reaction to see if they're confirming that, we're really not going to get the result, and this treatment could take 4 or 5 years, and we still may never get the result that we really need, because it's not how the system is meant to be used. And at that point, I try to talk them into at least starting with lower braces. I say, listen, what if Invisalign got us close, but we just finish you with 2 or 3 months of lower braces, and then at the end of treatment, if that was fine for you, we could either just continue with upper Invisalign and be done on the bottom, maybe do a lower permanent retainer, or if you like that, we'll just do upper and lower braces and just be done in a few months. So I talk to them about it. But we're very familiar. If people are not wearing their aligners, the aligners are clean. A lot of times the aligners are left at home. A lot of times when the patient walks out of the office, they take the aligners out of their mouth and they put it back in their purse. So it's okay. We're not trying to be difficult, but we are trying to get the result. And I do want to get a great result. I don't try to keep scanning them and just burn the patient out, as I've heard some orthodontists do. That's not what I'm trying to do. I really do want to help them get the smile that they want. And I tell them, hey, listen, sometimes we just have to do the thing that we know we need to do that we don't want to do. In this case, it's a short phase of braces. And then I take advantage of windows in the calendar. The winter is a great time where there's nothing going on socially. And I'll say, listen, let's just do braces for 2 months on the bottom, see how they feel. When we're done, we'll do a permanent retainer. And if you love that, we could always entertain doing that for the top. But doing a hybrid technique of upper Invisalign, lower braces, man, that works great. So that's how I approach adults who are struggling with their compliance. I do talk to them. I don't place blame on them. I try to encourage them into fixed appliances at no charge. And I definitely don't just keep scanning them until they fade out of the office. Let me know what you think about this, Pearl. Thank you guys so much for subscribing to this page. Thank you for supporting the JCO.